Okay, chào cô. Good morning, everyone. And first, I would like to thank the organizing committee for inviting me to be the speaker in this conference. It's my honor to be here. And today, my topic is pediatric poisoning, the trends, challenges, and clinical approaches. As you heard about the previous pediatric case with copenhagen poisoning before, I will go to pediatric poisoning. I do not have conflict of interest, and the references used for this lecture is are from the textbook and some studies. The outlines of my talk will include like epidemiology, the factor associated with poisoning in children, the management, and the preventions. First, the pediatric age groups are divided into like neonates, infants, toddlers, school-age children, and adolescents according to the age. And some use the cutoff 12 years old for children and adolescents. For the epidemiology, this is the study about international epidemiological differences in acute poisoning in pediatric emergency departments, performed in 20 countries, performed in like America, Europe, Mediterranean, and Western Pacific. And they found that there are substantial epidemiological differences in acute poisoning among children in different countries and regions of the world. The poisoning is significant and preventable cause of pediatric injury. According to the data of American Association of Poison Control Centers, pediatric exposure occur or accounted about 60% of all, mostly in young children for 80%. You can see the data, the young children, especially younger than 6 years old or 12 years old, they exposed to the household products or the products or xenobiotic that are found in inside the home or at home, while the adolescents exposed to pharmaceutical more or the drugs more. The characteristic of ingestions by young children, mostly without suicidal attempt, usually one xenobiotic involved, non-toxic xenobiotics and small amount, and the toddler usually present for evaluation quite soon. So the clinical effects of pediatric poisoning almost all only minor or none. However, they still occur, especially for adolescents with intentional exposure. The data in United States, this is the study for fatal poisoning in young children, younger than 5 years old. They found that OPS were the most common substances contributing to fatal poisoning, followed by the over-the-counter drugs like pain or cold allergy medication. And this is also the study about the fatal poisoning in the children younger than 9 years old, and opioids accounted for about 50%. And when we look at the data in Asia, this is the study in Malaysia, they found that the poisoning in children, like young children, younger than 5 years old, was mainly unintentional, while the adolescent was mainly intentional, and pharmaceutical and household agents were responsible for most of them. This study is in Thailand. It's from the North part, Chiang Mai University Hospital. They reported that the medications are the most common substances that the patients expose. with the mortality rate about 3% from the suicide attempt by adolescents, especially the pesticide like paraquat. When we look at our data from Ramadi Poison Center, our poison center, we have the calls about 40,000 calls a year, and most are from medical personnel, more than 95%. That means that they are the real cases in the hospital. We found that the most common age group was 1 to 6 years old, followed by the adolescent. And the causes of poisoning mainly from accidental exposure. However, you can see that suicide attempt or intentional exposure were the second one. For the toxic substances, we found that the medical drugs, especially paracetamol, was the most common substance that the patients exposed, like paracetamol for 43%, followed by the household products, which the cleaning agent for laundry about 20% was the second one, and pesticide, with the most common with pyrethroid poisoning. This is the data when we look at very young children, like less than 6 years old. 10-year retrospective cohort study, and they found that most were accidental exposures. Household product was the most common substances, and almost all had excellent outcome. However, we found the death cases, like 0.3%. That pesticides were the most common cause of death, mostly cases from paraquat, followed by organophosphate and carbamate. Our finding might be different from other regions' finding, like you see in US, that opioid accounted for the most fatal poisoning. For that, the factor that contribute to the children to be maybe more easily poisoned. The three main factors that contribute to that include like the host, agent, and environment, right? The patient host, right? Physiology, development, and behavior of the children. The agent, like some look-alike product that resemble like candy or food, so the children can eat them. And for environment, like some chemical are stored in the area low to the ground, right? Beneath the sinks that the children can reach, or unintentional exposed to those xenobiotics. This slide shows like the host. There are physiologic differences between children and adults, as you can see, right? Such as immature blood-brain barrier, hepatic metabolisms, or immature renal functions, or differences in protein binding. So for the host, right, growth and maturity, important factor that affect acne of biologics in pediatrics, like absorptions, gastric pH, gastric emptying, or transit of the children are different from the adults. And for distribution, right, membrane permeability, protein binding, or water, or even metabolism like phase 1 and phase 2 reactions by cytochrome P450 and excretion. These are right, the phase 1 and phase 2 enzyme activity that you can see that the children have this activity lower than adult, and like changes in like body water, extra and intracellular fluid, or tissue distribution and renal function. This is a different physiology. And for premature newborn, they also have different physiology that might affect the metabolism of the drug. So the metabolism might be different from mature newborns or children or adults. And for agents, even like small amount of the drugs, or like only like 1 tablet or 1 teaspoon can kill the toddler or young children, like calcium channel blocker or like pesticide. Some agents can cause delayed toxicity in children, like atopic